Hi everyone, my name is Brinley Peterson. I'm the Client Services Intern here at Home of Hope, the Cancer Wellness Center. So today I will be discussing a PowerPoint about maintaining relationships throughout the cancer diagnosis. So how does cancer affect you emotionally? So I know there's many ways cancer can affect you, but a cancer diagnosis can affect the emotional health of patients, family, and caregivers. So the common feelings during this life-changing experience can include anxiety, distress, and depression. So these roles can be affected at home, school, and work. It's important to recognize these changes and help when needed. How does cancer affect you physically? So I know there's many ways that can happen, but just a few would be fatigue. So feeling tired is a common among cancer survivors. Fatigue can also happen for caregivers who are caring for the cancer patient, just being run down and tired from everything that is going on. So exercise and relaxation skills and strategies can preserve your energy to be able to help. Hair loss, chemo and radiation therapy can cause temporary hair loss for many cancer patients. Hearing loss, chemo medications and high doses of radiation therapy to the brain can also damage hearing. Loss of appetite, cancer treatments can make food less appealing and can cause nausea and vomiting. So pain may result from cancer, surgery, nerve damage, or other factors. How can cancer affect relationship? So cancer has a major effect on marriages and other long-term partnerships, or even family relationships, relationships with friends, co-workers, your children, basically anyone that you have a relationship with. So after a cancer diagnosis, both individuals may experience sadness, anxiety, anger, or even hopelessness. The effects of cancer can vary from couple to couple, and for some couples, facing the challenges of cancer together strengthens their relationship. Communication. So when you have relationships, you should keep the communication open and even take the lead in talking. Some friends and family members may avoid talking to you simply because they do not know what to say. Others may fear that talking about the cancer will upset you and they may avoid talking about it. So if you feel like talking about your cancer journey with specific people, bring that topic of it up. By bringing the topic of it up yourself, this may allow the person to feel more comfortable talking about it and know that you are also open to talking about it. Develop skills. Rely on the skills that you have developed over time. Most couples do not realize that they already have the tools to cope with cancer based on previous crises. So previous things that you have gone through in relationships can help prepare you for this cancer diagnosis. So some of the developed skills you've already made as couples would be listening, nonverbal communication, emotional awareness, and management and questioning. So remember how you overcame these difficult situations in the past, and they can help a couple develop coping strategies in the current situation. So use your previous difficulties to get through this new one. Time out. Allow for time for yourself by yourself. Cancer and the treatments can cause different spouts of emotions. Anger, sadness, and depression are just a few of those emotions, and it is okay to take time for yourself when you are feeling those emotions. Explain to those around you that you are okay, but just need the time to yourself to comprehend your emotions. In this way, they will be more comfortable letting you be by yourself. This will allow for you to fight your end goal of cancer and not those you love. enjoy the journey. So remember to do the things you love while going through this difficult journey with the people that you love, your spouse, your children, grandchildren, family members, friends, co-workers, anyone. So remember to do the things you love with them and do not allow cancer to overcome everything you do. Go outside and enjoy the things you love to do with those around you. So for example, going fishing, bike riding, going for a walk, going to a grandchild's sporting event, going to the movies, playing board games, or just getting ice cream. So take time to go out and do what you enjoy with each other. Support networking, use your support group. So be able to give your caregiver or significant other a break. This person is more than likely feeling all of the emotions that you are. So understand that they will need breaks and or alone time also, just like you may need. So use your support network to allow for breaks when you need help in rides to appointments, meals being made or dropped off to you and your family, medication or grocery pickup, childcare or drop-offs and pickups from sporting events, practices, or schools, or just simple visits to your home to see would be examples of how you can use your support group. So support. So that would be like joining support groups, support groups that are local to you, or even ones that are online that might be from people all over the world or the state or wherever you can find them. So find other couples in a similar situation. And these couples also found support in groups and are more likely to understand what you are going through. So don't be afraid to seek tips and advice from others and share what you have found works in your own relationship, while recognizing that each couple's experience is unique. So learning how other people have coped with these situations can help you and the relationships that you're involved in. So therapy, speak with a therapist. Speaking with a therapist who is unbiased and has experience with other cancer patients may help couples express their emotions, confirm that the feelings they are experiencing are normal, and help provide useful coping tools. A therapist can help you cope with feelings, problem solve, and change behavior patterns that may contribute to your symptoms. So you can do therapy individually, you can do it with another person, so your spouse, a family member, a friend, a coworker, anyone that you feel comfortable with going to therapy together. Contributions. So benefits of contributing to relationships. They can help you live longer, become happier, age more gracefully, reduce stress, feel less pain, prevent a heart attack, sleep better, and heal faster. How to contribute. So ways you contribute is recognize each other for your commitment and caring, share in creating a positive and emotionally comfortable living space, make your relationship meaningful, balance the work and the rewards, and understand your partner's motivation and stresses.